welcome to a special episode of Livin the Good Life. My name is Amanda Kirk, and I am the social worker at the Beverly Senior Center. Today, I am hosting this episode on the topic of taking care of your mental health, especially during winter and during the time of COVID. I'm here today to discuss this topic with Nickey Mullen. Nickey is a licensed mental health clinician from the City of Beverly's Employee Assistance Program, or EAP. Nickey is the person city employees reach out to when we need help with things happening in our lives. We're very lucky to be able to share our resource with you today as we talk about mental health. So thank you, Nickey. Thank you so much for being here.
Thanks, Amanda. It's a pleasure to be here, and very exciting, very appropriate topics. So I look forward to contributing and talking back and forth with you about that for all of our viewers.
Oh, wonderful.
Great.
Yeah, so as we know, we've been through a lot of times of COVID, but we still are looking at winter coming up. And we wanted to take some time to think about how can we be aware and prepared and knowledgeable about people's mental health, especially during changes that might happen in winter months, and as the change in general, as it's the season of COVID now. So we know that seniors, it's a physical concern, but there's also a lot of loss of social engagement and social in-person activities. We've been all trying during the fall and autumn, working on their best ways to cope, but just wanted to look forward to the season of winter and talk about that specifically.
Mm-hmm. And just to acknowledge that since March, we've mastered a whole lot of ways to manage our isolation, to reach out, and even in this video and other technological resources, we've sort of found a way to overcome some of the challenges. So as we continue to talk about the topics, I'd encourage you to think about what have you mastered, what's worked well for you, even as we're talking about some of the challenges that might be coming our way. So
that's right. I think many people have tried something new, tried doing something different, connected online for the first time. We've certainly seen it here at the Senior Center, and it's really impressive. It's really impressive, the things people have been doing. So some topics that come to mind for me when we talk about mental health and winter especially are some things called depression or seasonal affective disorder or anxiety. So if we could spend a couple moments talking about what that looks like how somebody might know or have a clue that this might be going on for them. If there are any cues that if somebody noticed happening to themselves or to a friend, somebody that they're engaged with and communicating with, what would it look like, and what are the things that we should be looking out for?
Yeah, and these are so predictable, aren't they, Amanda?
Yeah.
I mean, we both of us work in the mental health profession, and it is. As the light gets dimmer, as we turn our clocks back, it gets darker earlier. It certainly has an impact here in the Northeast. And so if we can jump ahead of the game and think about how are we going to manage this? How do we recognize those cues in the early stages? Certainly you can get ahead of the game.
That's right.
Yeah.
So I think that if I were wondering if somebody were having some connection to depression, some symptoms or some cues, signs of depression, I think they might be feeling a little bit worthless, maybe. They might be wondering, maybe feeling a little bit hopeless about their days or what they see as the future going on. They might maybe be afraid of something bad happening. Maybe some loss of energy. Those might be things to look out for.
And also, I think sometimes depression or seasonal affective disorder sneaks up on you. And so it can be very isolating. It can be an internal process that that you're not aware that maybe sharing that, talking to someone, reaching out, getting resources, talk to the senior center, talk to friends, family members, is really important if you start to begin to feel like you've got a little bit of the blues. It's predictable. I think we all have a little bit of that when we change from the summer into fall into winter. Yeah.
I know I always have to change from summer mentality to what's going on for winter and what are the things we look forward to in the winter season. And like you said, the lack of daylight can really change your mental perception.
And I think that that's, one of the interesting things about when our significant holidays are during dark times. And that may look different this year. I know Dr. Fauci is recommending maybe not have these big Thanksgiving meals, and just planning ahead so that you're safe and that you're keeping yourself well and healthy, and staying connected. So connection and relationship are crucial during the winter months, and particularly this winter. I think we're making great strides in medicine. We know that we need to wear masks around each other. We know how to protect ourselves. It's pretty common knowledge. And if you're watching this and you don't know, don't hesitate to reach out and ask how to keep yourself safe. But with all of those practices, finding ways to get your strategy. How are you going to make it through winter and look forward to spring? And spring is going to bring us some, I think, very positive changes.
Can we take a moment and think about if somebody were feeling more anxiety or worried or feeling more upset than they had been previously, what that would look like? Maybe feeling like losing control over their circumstances. And then maybe some physical things might happen, like feeling a lot of muscle tension, or pain or headaches, things that worries in your mind that show up in how your body feels. That can be connected to anxiety too.
Absolutely. And, if we had a crystal ball, we'd know what's next around the corner, but we don't. And so anxiety tends to be also linked to kind of a lack of a sense of control. And I think it's very predictable. We have seen a rise in mental health of anxiety since the pandemic began. And so understanding that this is going to be predictable, and that normalize it. You'd be surprised if you talk to other people that they may be feeling exactly what you're feeling, and you find company in that exchange of conversation. I know that I have with my colleagues, and friends and family members, to be able to talk openly about it kind of reduces the power that anxiety can have control over you.
Right.
Yeah.
Saying something out loud to another person is really helpful.
Absolutely. And also recognizing kind of strategies that have worked already. If you have had anxiety in the past, many people have, what helped you to move out of that? One of the things that we know, and I know we'll talk a little more about exercise later, but sometimes just being very sedentary, which is winter naturally has us slow down physically, but sometimes given kind of the situation we're in at this time, being sedentary means your mind is kind of racing or having thoughts over and over and over again. And if you start to
over and over
again, it's really important to understand that is just the mind repetitively thinking the same thoughts, and very important to get up and move and change the scene. We'll talk a little more about media, but don't overexpose yourself to things that are very stimulating or provocative. We live in a very provocative driven media world right now.
I think it's important also to say so many people have gone through loss during this time.
Yes.
And that sometimes can look like depression too. Some of the symptoms, the signs are very similar. But we know that many people have gone through loss and it's felt different than previous losses because of the lack of social connectedness. So
yes.
I just want to say that we know that is something that many people are carrying as maybe a loss of a specific person, but also how life felt, how their normal felt. So to acknowledge that, but then to think beyond, I think we're gonna talk about some wellness activities. What can you do? Like you were alluding to many of them. What does it feel like to think about your overall wellness and some good strategies that can help us feel good from day to day?
Absolutely. And I think that it's really important that it's individualistic. It has to really work for you. It has to be something that you're interested in. Maybe you share with other people. The networks may have changed how we communicate with each other. I know, having worked and visited the senior center on several occasions and really seen the fullness of that program and the real loveliness of the community there. The programs at the senior center continue. They're just a little more remote, or there's a little more opportunity for that connection. We're talking about some of the psychological symptoms that may emerge at this time. I have also heard people very welcoming to kind of this thing slowing down and finding a way to pick up entertainment. Maybe they're baking more, or maybe they're doing a little more art, or initially it was a little shocking to have to slow down, but the gift of time is wonderful. If you can find ways to make use of the time. I know one of the things I'm doing right now is I'm Zooming some art classes.
Wow.
Yeah, just to really make sure that I'm doing something that is out of the work realm, out of any kind of demands, and into pleasure. So what makes you happy? What's your groove? Yeah.
Because we're not rushing around as much. Rush here for this, rush here for that. That's a good way to look at it from a different angle. If we have more time, how can we use it well? And like you said, to do something you enjoy doing.
Sure.
Sure.
And the technology, we're so lucky to have things like Zoom, to have this forum that is equally, you and I are both in very different locations.
That's right.
And here we are talking to each other, which is really unprecedented too. And there may be people out there who aren't familiar with how to use these platforms to meet family members, or maybe grandchildren, or just connect to friends. But maybe there are people who know how to do this, who can help you really develop this skill. I know we all had to. I'm used to meeting with people in person. And, to have to adjust to a Zoom call as a therapist has been, a learning curve back in March, but I think I've mastered a good bit of it.
Yeah, no, I found that for me too, that the first or second time you click on something or try, it feels very stressful. But, once you're at the 5th or the 10th time, you feel like, oh, this was actually pretty user-friendly. Okay, I can do this.
Sure.
Okay, it's not as, as stressful as I thought. And actually, it's nice to see somebody's face. If it's possible for you.
Yes. And safely, without fear or risk of exposure. If you have pre-existing conditions, you really want to stay in the health zone. Yeah,
it's worth it. I always said, at first I said it's better than nothing. But like you're saying, it allows to not be rushing around so much. It allows us to see people's faces. some families are connecting when people live all over the country. They can all join the same call.
Yeah.
They're all there in a virtual online space, but it's nice for that.
Yeah. Yes, absolutely. Yeah. Absolutely. Yeah. Just a little learning curve to it.
Right.
But I'm sure some of our listeners remember days where they didn't have TVs or telephones.
Mm-hmm.
I remember not having a television when I was little.
Yeah.
And we figured it out. We found a lot of ways to entertain ourselves without that.
Right. Yeah. Or cell phones, right? When people didn't used to walk around with a phone in your pocket or purse, and people adjusted to using cell phones and having them available and using that technology. So,
yeah.
We'd like to talk a little bit about how people can take care of their overall wellness. Some pieces about overall health and wellness, while acknowledging that through the whole COVID pandemic, people have been. Many people have learned new skills, like those technology skills. And people have really been surviving, finding ways to do things differently, really showing their strengths. I think Beverly has been a wonderful city for that. People have been caring about each other, aware of each other. And so that's been really encouraging through it. So let's talk about some things we can do to stay connected. There's the virtual piece, but how else might we do that?
I think of, for example, I know that I've had some conversations with the people at the library trying to figure out how to get media resources and books, videos, audio books.
Right.
And they've really gone above and beyond in the city of Beverly. You can order things, pick them up curbside. Yep. They're happy to help you. And that breaks a little bit of the isolation. It feels like you have resources and free resources that you have access to. So thinking about that as one example of using community resources that are available. Yeah.
Wonderful.
Yeah.
And then with friendships, the piece about being not just the person to receive the call from a friend or family member, but if you're thinking about someone or have concerns about them, reaching out to them. Don't be afraid to continue to pick up the phone. If you have a weekly chat or a couple times a week, just being able to connect. And if you're concerned about somebody, calling them, just checking in, day-to-day things, but it's a good conversation to have.
Yes, it's so important. And, we hold our loved ones in our hearts and our minds, and we wonder how they're doing.
Right.
Even grandchildren or, what's going on at school, just having conversations just to feel that connection, even if it's not a physical connection. And I think that people are so respectful. No one wants to make anyone sick at this time. And the COVID has proven to be a pretty powerful force globally. So it's not just the city of Beverly, it's everywhere. And the safety, keeping each other safe is a way to show you that you love each other. But not staying connected is a way to feel isolated and alone. And the biggest enemy is really feeling so alone and so isolated that you're not hearing from people, not speaking to people.
Yeah.
We only create our own sense of worth in relationships with other people.
Yeah.
We all really need each other.
Right. Well, thank you for bringing that up. And I think speaking from here at the Senior Center, as part of the city, we really want to stay connected to people as well. We are here, we are open, maybe not for the big physical presence that we've had in the past, but the staff are here and we love to speak to people on the phone. If you don't have the newsletter, you can sign up for the newsletter. We'll send it to you. We have different creative ways of staying connected. But please consider the Senior Center a resource for you. We don't want people feeling like they can't reach out or feeling like we're not available. We certainly are. What about the piece about exercise? You had said earlier, keeping your body moving, keeping your muscles moving, and not becoming sitting too long in one place. It's just a good skill of self-care to keep good for your heart. It's good for your brain. It's good for your muscles. Just thinking about how to build in exercise or movement into daily life.
Sure. Not to mention how we saw, if you think about COVID, when we could begin to get outside, begin to get sunshine, fresh air, the numbers dropped.
Right.
And that's pretty significant. The sun is full of vitamin D. And it's a really good thing to try to go outside. Even if it's cold, it makes a huge difference in terms of your health. But even if you have to do laps around your apartment or house, just moving things along, or even as you sit, kind of moving their necks, doing neck rolls, shoulders, just you know what they say, if you don't use it, you lose it. You gotta move.
Right.
Never stop moving. Yeah.
Even sitting down, there's plenty of chair exercises and activities that people can do. It doesn't have to be a huge workout. It's certainly fun if it is, but there's plenty of things people can do even sitting down. And here on BevCam, there are daily exercise classes available to seniors. So that information should be in the newsletter, or you can certainly call. Yeah, to see some of the same instructors who've been here. It's really nice to see them running their class and gives you connection to the class, and as well as in the moment, good for your body to keep things moving.
So if you're moving and if you're exercising, make sure you have your water bottle on hand and keep yourself hydrated.
Right. Thank you.
Yeah.
And then you, after staying so hydrated, get up again and go to the bathroom, and that's another movement. But it's a good way to keep your day going and staying hydrated. Thank you for that. Yeah. Speaking of drinking water, the importance of eating healthily and paying attention to nutrition and how your body feels related to what we're eating.
Even just planning ahead. Sometimes when it's cold out, who feels like going out and going grocery shopping? But planning ahead and maybe freezing meals ahead of time that you can defrost and eat that are healthy. Make batches. I know I usually every Sunday I make a big batch of vegetable soup because I know that it's healthy, and I'll freeze them and then I'll roast the soups that I've made.
Right.
And finding a way to keep all those nutrients in, which in the winter months we're a little harder on our bodies. It takes a little more of a toll on us.
I love that idea of your weekly soup.
Oh,
nice and warm in the winter too.
Yeah. And Sunday's a great day to do it because you're home and it's quiet. Yeah.
Right. And so the importance of remembering to eat through the day. Your breakfast, you have a lunch, you have a supper, and keeping that nutrition for your body and muscles to help with that movement and help support your muscles and bones, and just keeping an awareness of the healthy fruits and vegetables and grains and healthy foods like we've been talking about. And if you need a reminder to eat, setting a reminder, if there's a certain TV show that comes on at lunchtime, maybe you connect it to that. Just a reminder to eat throughout the day.
Yeah.
Not get too hungry.
Yeah. And little snacks in between. I know some folks, as they age, they have less of an appetite for that full plate that maybe they, when they're in their 30s or 20s could very much take, and breaking it down into little portions, and especially with protein, so that protein's a really good brain food. But fruits and vegetables too. Yeah.
Right. Thank you.
Yeah, sure.
Here at the Senior Center, we can help connect people to nutritionists.
Great.
To help learn about healthy eating. If somebody feels like, oh, I'd like to learn a bit more about that, or figure out how to, I know about the topic, but how am I going to use it for me? How am I going to implement it in my daily day-to-day? Please reach out to us, or also with your doctor, asking about what kind of nutrition you might be lacking, what kind of foods might be recommended. Just always a conversation with the doctor about that is a good idea too. Yeah. But
I know that you mentioned when we were sort of briefing to do this, that the Senior Center has a CSA.
Yeah.
Which is really great. So very fresh, beautiful vegetables that people can have access to, which is a really nice program. It's probably the tail end of it right now, but how wonderful that you have that for the seniors.
Yeah, thanks. We've really enjoyed that. And there is a community garden as well, run by volunteers from the Senior Center. And the volunteers planted it and tended the garden. And then over especially August and September, they were bringing the vegetables to the Senior Center, where we had an outdoor farm stand, and people could come and pick up a tomato and pick up some cucumbers. And it was just a really lovely program.
Oh, that's great.
Yeah, it was really fun.
Yeah.
So that was a great piece of, it was still distance, but it was a good piece of connection over the summer, related to the nutrition.
Yeah.
I
mean, I'm a huge advocate for touching nature, seeing nature. We spend a lot of time indoors these days, if it's as we move into the winter months, and how refreshing it is to see very fresh vegetables and things that people grew themselves, which is really very happy.
Right.
Yeah.
It was a beautiful connection with so many people involved in the project. Yeah. We should probably talk briefly about concerns if somebody is maybe drinking too much, thinking about hydration and drinking, but what if it's substances, or putting things in your body using substances that are not going to be very helpful. I know many people in general could use that kind of thing as a way of coping with feelings of sadness or feelings of emptiness or hopelessness. So if you find that you are using substances more often recently or in the winter than you have, or if people are expressing concerns about levels, about what they see happening, to take note of that and talk to somebody, maybe your doctor or a care provider, just to take note that the way we are helping ourselves is truly, like we're saying, a healthy way.
Yeah. So I do a lot of alcohol and drug counseling, and as part of my work in EAP, and I have throughout my career. It's so important to not be ashamed. Shame comes into those conversations, so it becomes difficult for all of us to admit, maybe I'm overeating, maybe I'm drinking a little too much. However, what we're starting to see statistically is a significant number of people are reaching for alcohol to get through the COVID crisis. And I'm always worried if it's being mixed with other medications, blood pressure medications, or let's say SSRIs, or some kind of medication that is already got an impact on the body. It's so important to be, if you are going to drink, to be very moderate and not fill the glass very full. Rather sip a little bit more gently at it if you possibly can. If it gets ahead of you and you feel like you need a little help, there's a lot of help out there. We have a lot of solutions. I think the biggest challenge for people who are maybe using alcohol to get through the dark days, alcohol is a depressant. So it'll lift you up for a little while, but it will also, you'll crash. It's a depressant. And it will impact sleep. It will impact mood, and it also can be very expensive. So, so we are a culture that that can be moderate social drinking. I believe that if you can kind of enjoy a drink now and then socially, and if it's not impacting your health or wellness, that's important. But as we age, our tolerance becomes lower for how much we can actually take, and impact on the liver and the kidneys and just your entire biophysiology is different. Impact on your brain. It actually goes to the brain much quicker, and it's easy to fall into if there's family gatherings or events, and if we have a culture where people are drinking considerably more just for the release from the anxiety from COVID, which we know to be true, then it's really easy to fall into that kind of communal event, of celebrating. But I caution you for sure. And the risk of maybe just being a little more tipsy than you are, result in falling, in injury. So we want everybody to stay really safe and celebrate life and enjoy your gatherings, but moderation, everything in moderation, is really best. Not to mention the dehydration that goes along with drinking, which the body, it takes a couple days to kind of get hydrated again.
Well, thank you for speaking to that.
Sure.
I think it's something that's very subtle sometimes, that seems easy, but we want to know, if this is something happening, that just being aware, like we're talking about overall wellness and resilience and how keeping your body in the best condition, especially through the winter and COVID. So thank you.
Sure.
Something that I always personally think helps me is to be aware of what I call the level of input. How much, especially media input, but how much during the day am I listening to and paying attention to, and how many voices am I hearing, and what are they talking about, and how much news is going on, or how much radio. And so I think something to be aware of when we're thinking about how restless we can be, or on edge, or worried about things, is, what is your brain paying attention to during the day? What are you hearing and seeing? And is it a healthy level?
Yeah. And it's no secret culturally that right now the news is extremely provocative. There's a lot going on, regardless of what your political affiliation is, or what your moral or ethical beliefs are. Our country is really a bit on fire. And we can have media overload. It can be We can even forget what the voice is inside our own head, what our opinions are, when we're really bombarded with a lot of information that maybe is too much, along with just some of the surprising things that are going on culturally. We are a nation in some distress, and the globe is in this same distress. So creating from, the time you wake up to the time you go to bed, a peaceful environment where you feel safe and you can rest and you can feel sheltered, really, from some of that bombardment is really a wonderful preventative strategy. And I don't know about you, Amanda, or the viewers out there, but I really love PBS because their commercials are very limited. We have some very interesting series on TV as well. We, of course, can stream things like Netflix or Hulu or National Geographic, or Hallmark Channel tends to be a little gentler on the heart. And what we know in psychology is what you focus on, you get a little bit more of it. It magnifies. And if you're constantly hearing angry, adversarial conversations or news reporting, it gets in there. It can become very toxic. And it's not just your brain listening; it's your whole body. And your body can have reactions that you're not even aware of, but it can really release a whole lot of stress hormones, can really work on your immune system and your capacity for wellness.
Right.
So I'm a huge advocate for really limiting media screen time unless it's something that brings happiness and peace to you.
Yeah.
And don't underestimate music, and especially calming music, things, just background music that's relaxing, that's calming, can have a pretty severe positive impact on the brain. And even that, we talked earlier about reaching out to those people that you think about. Reaching out and expressing your gratitude to those people can be can open up a whole wonderful conversation. It feels good to feel good.
That's right. Yeah. And speaking of feeling good, being aware of our physical health too. Any particular medical conditions or diagnoses, what's going on with your physical body. We just want to talk about feeling free to connect with your primary care doctor or nurse, checking in with that person or that team, and letting them know if you're feeling different, if you're feeling unwell. I don't think any call is too small of a call to make. A phone call to your provider.
I agree. And to remember that if you're on a medication, it's important to be consistent about that. And so be sure that you have a good supply of your medications in the event that it becomes difficult to get prescriptions renewed. And I know that some people have senior care involved in their lives as well, and or caretakers, personal caretakers. So just be sure you have enough toilet paper, right? And that we could have a shortage of disinfectant again or wipes. So not to create a panic, but rather just, we know now how to prepare for the event that if something escalates, and to take care of that. So just encouraging everybody, your wellness is number one. Better you get healthcare now than if it's a pandemic and you need to go into places where people may potentially be infectious.
Right. But I know many people were thinking, oh, I shouldn't go to the doctor. I don't want that to be a place of contagion or exposure. But like you said, we've been through this now for a while, and medical providers have systems to care for routine medical needs and sicknesses, as well as people who have COVID and taking care of those needs without spreading contagion. So it's really important to do those normal visits.
Yes. And even during COVID, I had a few doctor's appointments, and it was very clear how they very carefully separated out potential COVID, from people who really needed basic medical care. But I did, I've read a lot about how people were less likely to check into an emergency room with cardiac symptoms, for example, during COVID. And what we don't want people to do is disregard their body cues or signals if they're not well. And I think that there was some concern around medical professionals that people weren't accessing care. They were concerned to do that. So just reassuring people, I've been in situations with medicine, and I've seen how very carefully and respectfully people are managing that as medical professionals. So healthy first. Yeah.
Well, let's talk about how to reach out if somebody feels like they need more help for themselves, or a family member, friend, someone they're concerned about. We did just talk about the importance of being connected to your primary care, and knowing that office and the phone number, even being comfortable with telehealth visits, the remote visits where people have still been able to talk to their doctors. But feeling like that's part of the team that is caring for you and caring about you, is your medical providers.
Absolutely. And also keeping up with, besides telehealth, keeping up with, routine blood tests. I mean, there's plenty of places to go to be sure that, if you need to check to see how things are going, cholesterol, blood pressure, liver functioning, et cetera, because of meds, so important to just keep that going.
Right.
And I think doctors know that as well. They're, we've begun to really get a recipe. I know I spoke to a whole group of primary care docs yesterday. And their news is, yes, we see things on the rise, and yes, we're prepared this time very differently to manage this. And I also want to say, I hope people are having fun with the mask thing, because it's now a fashion accessory.
Right.
We don't have it on because we're obviously in an isolation situation, but all kinds of very pretty fabrics. I saw some ones recently for the winter, and wild leopard ones, and all kinds of
coordinating with your outfit. You can make it an ensemble.
Every day is Halloween.
That's right.
Yeah.
I think people have figured out too, what kind of mask feels comfortable, how to get a good fit around your mouth and nose and chin and around your ears, so that, I think we're kind of used to it. I've noticed as it's gotten colder out, sometimes it keeps my face a little warm. So
yes,
there's a little benefit. Another benefit.
Yeah. I think initially it was a bit shocking to go out in the world and see people in masks. It's just, but I know I'm very used to it and very grateful for people really practicing that, and really listening to the scientists and how wash your hands, make sure you socially distance, all that stuff. And so, finding a way to, it's how we show we love each other. Instead of hugging and getting really close, now it's sort of like,
a wave.
Right. Drive by.
Oh yeah. A lot of drive-bys, a lot of notes in the mail, text messages if you use a cell phone, something like that. But just people just understanding that that's how we can show appreciation and love and connection.
Mm-hmm.
Yeah.
Mm-hmm.
I'd like to say that people can always call the senior center too, to reach out for help. I am the social worker here, and it's part of the social work and outreach office. We really are wanting to be aware of and connected to people in the city who have questions about things, who might be concerned about themselves or a family member, friend, household member. So please feel free to call us. The number is 978-921-6017. That's 978-921-6017 to the Senior Center. And we are open from 8 to 4, Monday, Tuesday, Wednesday, 8 to 7 on Thursday, and 8 to 1 on Friday. So please call and connect with us. Even if it's not on a major concern, we love to say hi and talk to people we haven't seen for a while. So
this is not a usual year,
right.
And this is not. It's not easy to miss certain celebrations, but just encouraging people to plan ahead. I think the anticipation of how things may be different is much more stressful than that actual day. So even though it's mid-October, I encourage people to begin thinking and talking to your loved ones about how are we going to do this differently and in a healthy way, because there is some potential prediction about a spike in COVID, stage 2 COVID. And yet we want to celebrate and we want to enjoy each other. So from my experience, it helps to not be disappointed or be lonely or feel isolated if you plan ahead and begin to get some ideas about how you're going to manage that in a positive way.
Thanks. And I like how you said talking to the people you might normally typically spend the holiday with, to make sure that everyone's on the same page, iron out any wrinkles, work on that communication well in advance, so that everybody's comfortable with the plan and you know what it is. And everybody understands that this is a different year. It is an unusual year. And making a plan ahead of time that you're comfortable with and your family or your friends, your community's comfortable with. That's a great tip. Thank you for that.
Yeah, absolutely.
Yeah. And another resource, an agency that we work very closely with here at the Senior Center is called Senior Care. I know many people on Cape Ann and Beverly are familiar with it. They are the folks who provide services to older adults in Beverly, and they have wonderful resources, programs, and provide just a lot of general information to people by calling there. They also provide Meals on Wheels. When we were talking about the importance of nutrition and eating healthily, Senior Care provides Meals on Wheels, and it's such a helpful program that meets the needs of many people in the city. So thanks to Senior Care for all their work, but they're also another resource. I think a lot of people have connected to Senior Care during COVID who haven't before. There are some help with home care or shopping, access to resources that they were able to provide. So we're appreciative of their efforts and help.
Yes, I'm familiar with them too. They're a wonderful organization.
Yeah.
Very resourceful.
Thank you. Do you think there's anything that we skipped over or just want to review before the end? Anything that you'd like to wrap up, or maybe I forgot to ask about? Anything that stands out to you right now?
I think, excuse me, just in my closing comments are, we talked about a whole lot of topics that that maybe, you know, are a little challenging to talk about, because culturally, any mental health conversations are always loaded with social stigma or bias. That we're much more comfortable talking about our diabetes or our cancer or our cardiac issues, et cetera, than we are talking about our anxiety or depression. But the culture is really changing, and I encourage people to be comfortable with it, and I strongly see mental health symptoms as medical issues. And previously, there would be a lot of judgments. There would be a lot of moral judgments about people's behaviors, for example, if they were having mental health issues. But what we know now from advanced psychiatry and interconnecting with medicine is these are medical issues, just like Parkinson's disease or having a stroke or you know, I mean, those are extreme disorders, but we really need to be comfortable talking about our mental health symptoms, which may well be linked into a physical symptom that needs medical attention. And I know I've worked with people who have talked all about their symptoms, but from an emotional perspective, and it turned out they had a medical issue.
Oh, right.
So never, ever judge yourself for symptoms that are having, even cravings. Let's say if you are drinking a little bit more, understand that that's a brain chemistry issue, that it is treatable. Recovery is possible, and resilience, people bouncing back. And we've all bounced back from March. I know. I don't know about you, Amanda, or our viewers, but boy, did we get broadsided back in March with COVID. I mean, I was traveling in Denver, Colorado, giving trainings, and all of a sudden I got the news we're going into isolation. I had to get home, and you know, it was like, what? What? You know, it was a real flip from life as we knew it to major adjustment, and none of those kinds of significant global traumatic events like the pandemic we're in, none of them exist without consequences. So I really, if anything, I just hope I'm delivering the message that don't be afraid of your mental health symptoms. Follow your cues. If you're not feeling like yourself, talk to somebody that you trust, a trusted friend or a trusted medical person. The big cue that I always hear, it's very interesting, but when I work with people and they work through mental health issues, is when they start to say, I feel like my old self, then I know that treatment is working. You know, so don't be afraid to look for your old self if you've got the blues, or if it's, you know, kind of a tedious winter. It could be. But find ways to be productive and to reach out and keep your loved ones close, however you do that. So I think that's what I would finish with is think positive and be resilient. We'll get through this. And next Christmas, you know, may well be a very different story. We may have a lot of reunions. And
that's right.
I'm hoping for that.
Keeping up the hope.
Yes.
Well, absolutely. Thank you.
You're welcome. It's my pleasure. And I wish all of you listening the very best in wellness and happiness. And we will get through this together.
That's right. That's right. Thank you. Well, thank you again to Nickey Mullen from the City of Beverly's EAP program for being here today and speaking with us about mental health. Once again, my name is Amanda Kirk. I'm the social worker at the Beverly Senior Center. And if you'd like to contact us at the Beverly Senior Center, you can call 978-921-6017. Thank you for joining us on this episode here of Livin' the Good Life, and take care, everyone. Bye-bye.